Alberta Health Services. Healthy Albertans, healthy communities, together.
Good afternoon, everyone. I am David Wyant, Chair of the Alberta Health Services Board, and would like to welcome you to this AHS public board meeting. Thank you for taking the time to join us. This is a meeting of the board to consider one motion. To start, in the spirit of recognizing the harms of the past, promoting reconciliation and gratitude, and in keeping with the calls to action from the Truth and Reconciliation Commission. On behalf of the board, I would like to take this opportunity to acknowledge that the work Alberta Health Services takes place on is historical lands and contemporary Indigenous lands, including the territories of Treaties 6, 7, and 8, and the homeland of the Métis. I would like to acknowledge the 46 First Nations communities within what we call Alberta, as well as the Métis and Inuit peoples who form an important part of our healthcare system. Our board members are joining us from across the country, and we acknowledge the Indigenous peoples' territories in which they live and work. We are grateful to those who come before us and mindful of those who will follow us as we steward and protect these lands. I want to take a moment to thank Albertans for getting their first and second doses of the COVID-19 vaccine, as well as the AHS teams that are helping Albertans become immunized. Again, I encourage everyone to be immunized. The medical and scientific experts advise us that it is the single most effective way to prevent transmission of COVID-19 and to help keep Albertans safe and healthy. If you won't do it for yourself, please do it for those around you, including the young children and others who are not able to receive life-saving vaccinations themselves. We are participating by telephone conference today. When I ask for a vote on a motion, I will ask for those opposed or abstaining. For those who neither oppose nor abstain, I will take it that you are in favor of the motion. If there are none or a minority who either oppose or abstain, I will declare the motion carried. May I ask that someone move approval of the agenda that has been circulated?
Mr. Chair, it's Deborah Apps. I will move the approval of the agenda.
Thank you, Deborah. Will someone second the motion?
Mr. Chair, it's Sherry Fountain. I so second.
Thank you, Sherry. Any further discussion? Any opposed or abstentions? The motion is carried. Based on the approved agenda, do any board members have a conflict of interest that they would like to declare at this time? Hearing none, we will move on. I now ask Brian, Chair of the Finance Committee, to present the motion arising out of the Finance Committee.
Thank you, Mr. Chair. The Finance Committee met on August 11th, 2021. I'm presenting one motion for board approval today. The committee reviewed an extension of the interim authorization to spend for COVID-19 costs in 2021-22 and recommended board approval. The board reviewed the extension and the members support the approval. Accordingly, I move that the Alberta Health Services Board approve amendments to the authorization to spend related to costs for the COVID-19 pandemic response previously approved by the Alberta Health Services Board on June 1st, 2021. To provide the following: the interim authorization period under the COVID authorization to spend be extended to end on November 30th, 2021, rather than August 31st, 2021. The maximum expenses under the COVID authorization to be spent be increased to $989 million for the extended period April 1st, 2021 to November 30th, 2021. And C, the maximum capital expenditures under the COVID authorization to spend remains at $28 million for the extended period April 1, 2021 to November 30th, 2021.
Thank you, Brian. Will someone second the motion?
Natalia Ryman. I will second that.
Thank you, Natalia. Any further discussion? Hartley Harris will abstain from this vote as he was recently appointed to the board and does not yet have the context that would enable him to vote. By the way, welcome, Hartley. Are there any other opposed or abstentions? The motion is carried. We have reached the end of our agenda. I declare the business meeting adjourned. Thank you for joining us, and please be safe, be well, and be kind.
Together, we do amazing things every day.